Even as I prepared to record this video for you all, I learned that the ACA credits will not be extended. If you think the collapse of the ACA will not affect you because you have good employee insurance, you're not paying attention yet. Hey everyone, it's Terry, your benefits mentor. Today I want to slow this conversation way down because healthcare isn't a soundbite issue. It's personal, it's emotional, and right now a lot of people are talking past each other instead of actually understanding what's at stake. Two proposed health plans recently failed in the Senate, and while some people are celebrating, others are panicking because millions of Americans are once again staring at uncertainty. So this video is not about defending a political party. It's not about pretending the ACA is perfect. It is about reality, about how we got here, what's about to happen, and who's going to be affected, whether they realize it or not. Let's start with this. The Affordable Care Act was never designed because people love government involvement. It was designed because the private health insurance market failed sick people, period. And before the ACA, you could get denied coverage for pre-existing conditions. You could hit lifetime caps while still sick. You could be priced out entirely. There was no preventive care, only emergency care. Children couldn't stay on their parents' plan until they reached age 26. And if you were healthy, the system worked great. If you weren't, you were invisible. The ACA said, no, being sick doesn't disqualify you from care. And that mattered. It still matters. I hear this a lot, so let's talk about it honestly. When someone says the ACA is garbage and government should get out of healthcare, my response is simple. I hear the frustration, but what's the alternative right now for people with no other option? Before the ACA, people with cancer, diabetes, MS, heart disease, they weren't choosing government health care. They were choosing no care because the market didn't want them. Now, let's talk about why things feel so unstable today. One of the biggest hits to the ACA was the repeal of the individual mandate, the requirement that healthy people stay in the insurance pool. That mandate wasn't popular, but it mattered. Insurance works by shared risk. Healthy people help balance the costs of sick people. And once that support beam was removed, premiums rose, insurance pulled out of markets, and stability eroded. The ACA didn't suddenly fail. It was systematically weakened. Right now, millions of people rely on enhanced AC tax credits to afford coverage. These credits are what keep premiums from exploding for middle-class families. And if they expire, premiums double or triple. People will drop coverage. Sicker people will remain in the pool, which would drive costs up even higher. You don't remove the safety net before another one exists. Extending ACA credits isn't about ideology. It's about preventing chaos while a real alternative is built. Now, let's clear something up. Government is already deeply involved in healthcare through Medicare, Medicaid, employer tax subsidies, drug patents, and emergency care laws. So the real question isn't whether the government is involved. The question is who gets protected when the system breaks down. History shows us this clearly. When government steps away completely, Insurers cherry pick the healthy and lock out everyone else. This is one of the biggest blind spots in the entire debate. About half of working Americans do not have access to employer-sponsored insurance. That includes small business employees, gig workers, contractors, part-time workers, caregivers, and early retirees. So what do we say to them? Wrong job? Wrong life circumstances? Good luck? Healthcare tied to employment only works if everyone's life fits the same mold, and it doesn't. This belief is incredibly common and incredibly dangerous because you are one layoff, one company closure, one early retirement, one serious diagnosis away from the individual marketplace. And here's what people miss. When uninsured care rises, hospitals shift those costs and employer plans absorb them through higher premiums. There is no such thing as someone else's healthcare crisis. The costs always come back around. Now, many proposals lean heavily on high deductible plans and HSAs. So let's explain this simply. An HSA is a tax advantage savings account for medical expenses. They're great if you're healthy and have extra income lying around, but you can only have an HSA with a high deductible plan. A serious illness will blow through those savings instantly, and most Americans, unfortunately, live paycheck to paycheck. You cannot HSA your way out of cancer, MS, or premature birth. HSAs are tools and not safety nets, and they do not replace insurance. If ACA credits disappear without a replacement, the sick get priced out, the healthy opt out, markets destabilize, employer plans get more expensive, and uncompensated care rises. This isn't theoretical. We've seen this movie before. A healthcare system that only works when you're healthy isn't a system, it's a gamble. And here's what works, and the data backs it up. Have strong protections for pre-existing conditions. Stable insurance marketplaces. Affordable premiums through credits. Preventive care. And work on building the next system before tearing down the current one. You don't tear down the bridge while people are still crossing it. This isn't about politics. It's about whether we believe sick people deserve care before they're profitable. You don't have to love the ACA to understand this. Removing coverage without replacement doesn't create freedom. It creates fear. And we can do better than that. And when we talk about health care, we are talking about the least of these. Matthew 25 and 40. People are sick, scared, aging, and one diagnosis away from losing everything. Before you go, if this video helped you understand what's really happening, please hit the like, subscribe, and share buttons, and make sure you share this with someone who thinks this won't affect them. I'm Terry Small, your benefits mentor, helping you make smart benefit choices one video at a time.